Hello, everyone. Thanks for attendance. I'm Mostafa Kamel. I'm a consultant psychiatrist and a lecturer of psychiatry at Faculty of Medicine, Tanta University, Egypt. Also, I'm a member of Addiction and Concurrent Disorder Group at the University of British Columbia, Vancouver, Canada, as I have just finished my PhD with Professor Krause this year. Today, I'm going to speak about the tramadol. Is it a regional problem in our Middle East or it's a global problem? As we are speaking today about Overdose conference, so as all of us know that North America is hit by the use of fentanyl, an opioid imported from Asia, from China. There is another opioid that threatens the other side of the world, here in Middle East and Africa, Tramadol. Tramadol here, which is also important from Asia, from another big country, is India, responsible for about the opioid crisis here in the Middle East and Africa. As we know that Tramadol is a weak opioid analgesic first introduced in the 70s in Germany. It's used as analgesic for both acute and chronic pain. It mediates its analgesia through working on opioid receptors and also act as serotonin norepinephrine reuptake inhibitor. Regarding the situation in the States, there is an increase of misuse of prescribed opioids. This is all opioid subtypes, but here we are focusing on tramadol, which is only about 1.3 million population start to be prescribed by opioid. Is this prescription affecting opioid use and opioid use disorder? Actually, yes. In a cohort study that I mentioned here in the reference, that about 70% of surgical patients in the States and Canada filled with prescribed by opioid, mainly tramadol, compared to only 11% in Sweden. Of the 3 countries examined, the United States has the highest average dose of opioid prescription. So not only the high percentage of prescription, but also higher dose after surgical procedures. Also in vaginal and cesarean sections in Canada, this is another study showed that there is clear association between perioperative opioid prescribing and new persistent opioid use after 1 year of the study, of the surgery. So for non-medical purpose, also there is an increase of misuse of tramadol in the United States and the European Union over the last decade, reaching up to 3.2 million population have used tramadol in their lifetime. This definitely will affect the ER visits. The number of emergency department visits involving tramadol abuse increased up to 250% from 2005 to 2011, reaching 20,000 related visits due to tramadol. Situation in Europe is not much different. That pushed countries like England and Wales to put the tramadol to be like schedule, and this little bit affect the distribution, not less increased for tramadol there. Canada also started to suffer from this problem, and there is a notice to schedule tramadol this year in Canada. So what about Mama Africa? In Africa, unfortunately, we don't have acute statistics of the level of tramadol misuse, but from epidemiological studies show that there is widely demanded problem up to crisis in some countries, especially in West countries like Togo, Ghana, Nigeria, and Libya and Egypt in the Middle East. In a country like Nigeria, the prevalence of tramadol abuse reached up to 54%, and 90% of subjects obtained without prescription. According to the United Nations Office for Drug and Crimes, this reached like a healthy crisis, an alarming rate in some countries like Mali and Niger. A country like Cameroon, city Garoua, which is one of the biggest cities there, hospitals trace about 80% of all traffic accidents resulting from tramadol, because as I mentioned that truck drivers and bus drivers are using Tramadol. And at least half of adults in the city are using Tramadol. Not only this, but also there is a waiting rate of population who are starting to have convulsing and epileptic fits, which is a sign of Tramadol overuse. There is increasing rate of those visiting hospital of this. In those countries, Tramadol death outnumber heroin death. This publication from Ghana, here on the tongue of truck driver, he said that with a Tramadol, I ride like a Jaguar. This is among commercial vehicle operators in Ghana. So this pushes us to think about one, why they are using Tramadol. What are non-medical purposes for those who are not complaining of any chronic or acute pain? Actually, there are multiple motivations for them. Yeah, as a substance, there is psychological motivation for like euphoria, being alert and attentive, and sense of hope. What I heard from drivers and workers, as I mentioned, say that for physical motivation, it's a booster their energy. They do not feel tiredness or fatigue with Tramadol. Definitely, economic motivation also is play a role, as it's very affordable, available, and very cheap. But from my clinical experience here in Egypt and other countries, this sexual motivation is the most common cause for using, because they improve their sexual performance and delay ejaculation for those who has premature ejaculation and personal distress, ejaculation related personal distress management. They are starting using Tramadol for this sexual purpose, and then they become opioid users. That make Tramadol in Egypt is the second most common substance among Egyptians after cannabis, reaching up to 2.4% of population are Tramadol users, which are equal about 3 to 4 million population. About 70% of people seeking treatment for addiction here in Egypt also are addicted to Tramadol. That put the red flag for high-risk population. Starts among manual workers, truck drivers, spread to women who are working in the market, but now the crisis reached the adolescent and student. We are now have a lot of high school and university students are using Tramadol. As I mentioned, truck drivers are one of the highest population of using Tramadol. In Egypt, truck drivers are regular users, assuming that, as I mentioned, to reduce their tiredness and sleeping over during their working hours. It's related to road traffic accident, as a study done in Egypt about for 400 drivers, 20% of them gave positive results. So not only, as I mentioned, for truck drivers, but also among manual workers. For this, there are a lot of efforts paid from the governments to control the situation, as global seizures, as you can imagine, of illegal Tramadol increased from less than 10 kilograms in 2010, reaching up to 125 tons in 2017. From 300 kilograms in West Africa to over 3 tons in 2017. So it's 100 times increase. In Egypt, in 1 year, the Egyptian authorities seized about 75 million Tramadol tablets. Tamol, which is called Tamol in Egypt, with concentration is 225 milligram, which is different from European and North American, which is 50 milligram, with budget about 50 million US dollars. So we have a dilemma now in our dealing with the problem, as most countries, even those who have the problem in West Africa and Sub-Saharan region, Tramadol is not on the list of controlled substance or regulated by authorities, making the drug is really available in pharmacies, in chemical shops, and you can even find it without any prescription. Another thing is that Tramadol is not on the international drug schedule or controlled substance that mandate regulations from the WHO. So still, the individual countries attempt to regulate it on its own and failing. For example, countries like Egypt, we started scheduling tramadol at 2010, but the problem is that without international scheduling of this problem, we have no control over the India, the main manufacturer of the substance, and we are still suffering from the problem. According to the United Nations Office on Drug and Crime, on their last meeting, I think 2019, they raised the alarm that for their World Drug Report that about addiction to Tamil rates in parts of Africa. They called it as a multifaceted global opioid crisis. And the impact of vulnerable population and the high-risk population, putting pressure in already highly stretched and strained healthcare systems in Africa and the Middle East. UNODC has also called for legislative change, not only by single countries, but for to be like a global attitude. This pushed us, as our lab with Professor Krause, to think about related research projects for tramadol. The first thing we worked on is the literature review to dig deeply in the tramadol problem and to see what is this problem is regional or international or a global problem. We developed an instrument. We are going on the next stage to share it with our experts in the countries who are suffering from the problem, like a Delphi panel, to see that problem, as I mentioned, what their opinion and ideas about to solve the problem. And we are going to set a webinar maybe by the end of this year, mainly for the tramadol problem. Our expert panel, including specialists from the most involved countries, we are going to ask them to get a better overview about the current challenge, identifying the main problems, identifying appropriate steps to support the safe medical use, to identify also important gaps of knowledge which need to be addressed through the collaborative research in the high impact region. Our objective is about to evaluate the use of tramadol in different countries and continents, identify the high risk use of tramadol, different legal and clinical handling and their rationale, and development of recommendations for safe use and clinical approach. Our research area are including medical and non-medical use of tramadol, major health consequences of using tramadol, the main problems with using it, and available treatment options for tramadol. As while we are searching, we found that a lot of countries are dealing with the problem in different maneuvers. We are going to find a consensus addressing the current situation and development of recommendations. We're also going to ask them about the regulation in their countries and their suggestion for about the changes that should be in the legislative level. This consensus finding addressing the current situation, we are going to ask them and find a recommendation about training in pain management, training in substance use disorder treatment, thinking about specialized programs for high-risk populations. As I mentioned, we are now suffering with youth and students, epidemiological surveillance about the problem, and guidelines for the medical use. There should be regulation and criminalization of using tramadol. What should be the clinical research that we should pursue in the next decade? And how can we build an international network? Our experts from North America, Africa, Europe, Australia, Asia, and internationally from European Monitoring Drug and Drug Addiction from Lisbon and United Nations Office for Drug and Crime. We now experts from all of these areas to participate in our Delphi study that we are working on, and we are going to publish these results. And thank you.